Imagine you are part of the 450 million people in the world with little or no access to mental health services.
The overall status of mental health care on a global scale is probably the least addressed of overall health care. Of course, in lower income countries, it's even worse. How much people are impacted compared to the resources that are given towards addressing these needs is very underserved.
In Malawi, in my country in particular, needed mental health training, needed mental health intervention.
Dr. Benedetto Saraceno, who was the past director of the Department of Mental Health and Substance Abuse of the World Health Organization, he issued a challenge to counselors around the world to create a way to serve the 450 million people who were underserved.
We had a small group of people who worked together to create the mental health facilitator program, and so that was a way that we could see to meet that need by training people who would go into countries and do culturally appropriate training in ways that could be used by folks living in the country, providing services to people within their same country or region so that everything was really applicable to the experiences that they were going through.
The MHF program is a compilation of mental health skills that are accepted around the world. It is then modified or contextualized for local norms to be used in local communities. The curriculum is multidisciplinary, meaning that it was developed by nurses, counselors, psychologists, and social workers, even psychiatrists. The MHF program is a 30-hour-long program designed for lay people and paraprofessionals, as well as professional people outside of the mental health field. The mental health facilitator curriculum includes information and education on helping skills, working with integrity, trauma, suicide, and identifying and referring people with mental health problems to professional resources.
The MHF program has competency training that allows the group within the country to make adaptation to the local culture and practice.
The MHF program is established after we have some communication with a potential program partner who might be interested in implementing the program to meet some needs and populations that they see locally in their community, maybe within their university or their organization. Those relationships can be with universities, associations, governmental organizations, non-governmental organizations, training centers, really anybody that wants to implement the program and work with us and has a population whose needs they'd like to meet.
The mental health facilitator training is divided into 3 levels. At the top level are master trainers. The master MHF trainers then train trainers, and the trainers train MHFs. So it's basically a trickle-down or a multiplier effect.
The mental health facilitator program could be one answer to create better services for the public in Europe. There are several things that I like about this program. The fact that it's very accessible, is not very long when it comes to the training, is very friendly, but probably what I like the most is the fact that it doesn't have any stigma, social stigma attached to it.
The mental health facilitators are not a new professional group. Rather, they complement existing care resources. The MHF program is a voluntary registry, which is maintained by NBCC International. For more information about the Mental Health Facilitator program, please visit our website at www.nbccinternational.org.